Thanks so much, Mohammed, and welcome, everyone. It's so good to see so many of you here. When we had the idea to have a series of webinars, we weren't quite sure what the turnout and the response would be. So we've really been overwhelmed both by your attention and by your presence here today. So thank you. Want to extend a welcome, of course, from the Comprehensive Cancer Control National Partnership. And hopefully many of you would know that the National Partnership, we are a group of 19 cancer-related groups. I'm sorry, I missed my notes page. But through coordination and collaboration, the National Partnership assists the comprehensive cancer control coalitions to develop and to sustain the implementation of the cancer control plans in their states, tribes, and territories, as well as the PIJs, and as well as on some of the local cancer coalitions as well. We were formed in 1998, and since then we've really maintained our work as a collaborative group of diverse national organizations working together to kind of build and sustain these efforts across the nation. And thinking about today's program, I think so well about how we as a group really try, particularly over the last 5 to 6 years, to model the kind of work that you're doing out in the coalition, to be responsible with our resources, to draw across from each other's strengths, and to really try not to duplicate each other's work, but really leverage each other's gifts and expertise. One of the really the foundational document for our technical assistance, particularly through the Sustaining Coalitions Work Group, is the 9 habits for successful coalitions. And today, just to kind of orient you a bit, the 9 habits were developed to be comprehensive, interconnected, and to really kind of speak to the coalition's culture and their way of doing business. And in no particular order, last month we looked at empowering leadership and those aspects of leadership that help us really sort of move our plans into practice. And today we're really talking about priority work plans, how we kind of leverage that work within our coalitions and within our groups. One of the things that we grapple with, particularly here at NCI, but I know that you do at your coalitions as well, is how do we really know that the work that we do matters, that it's grounded in something other than kind of our good ideas. And that's really the basis of the 9 habits. The 9 habits really kind of bubbled out of the technical assistance that's been underway really over the last 20 years, but particularly over the first 10 years of the National Partnership. And the American Cancer Society had a contract and really kind of began to sort of look at what are those aspects of successful coalitions, in cancer in particular, but also across the public health spectrum, that really kind of get at that important work. What do we need to kind of get our ideas forward? What do we need to get evidence-based programs into action within our coalitions? So one of the things we want to focus on today is cancer plan priorities. We know that cancer is a multifactorial disease. It's really at NCI we're talking about as being a cluster of diseases. And there's many different needs that are in our communities, in our states, tribes, territories, and jurisdictions. But so whereas we can't address all aspects of the needs in our community, we do need to begin to kind of suss out what are those priorities that will give us both a bang for our buck, but as well as to leverage our partnerships and really extend our limited resources. Why would you want to determine your cancer plans? And this slide kind of talks to it. But really focusing on a few things really will accelerate your progress, and the extent to which your coalition can pull upon the gifts and the strengths and the resources across your coalition, the more successful you'll be. So why do we have work plans? Not just because of funding issues, but really to align priorities with needs, as well as to make sure that we have a vehicle to engage your partners as well. Priorities for the work plans are chosen, and work plans are developed hopefully around evidence-based strategies, whether you're drawing from the community guide, research-tested interventions and programs, Cancer Control Planet, CDC's LIDS, literature review, some of the CDC success stories. Taking those evidence-based programs and strategies and putting them into practice by breaking them down and looking across your coalitions to see who can do what best is really the work of a highly functioning comprehensive cancer control coalition. So we're really excited to have this opportunity to amplify the 9 habits and to really look at this habit in particular. So I'll swap you back over to Mohammed and our second poll.
Thank you, Margaret, for that introduction. So as I said before, when you take a couple of minutes to do the poll, make sure you scroll down. This is a little bit longer, and we want to find out from you about the following statements that you're seeing on your screen and on the right side on the poll. Make sure you mark 1 for if this is something that is not happening at all at your organization or coalition, and 5 if this sounds like something that is happening at your coalition, and of course anything in between. And you can see the 3 statements. Priorities from the CompCancer Plan are identified every 1 to 2 years. Focus on the priorities identified from the CompCancer Plan, and then members know about and are involved in developing action plans to implement strategies. We'll wait a little bit and see your results. All right, great. So let's take a quick look here. And I believe you should still be able to see your poll questions. You just need to hover over them after we close the poll to see the full question. And what I'm seeing here is that from this self-assessment, coalition priorities from the CompCancer are identified every 1 to 2 years. We have about 50% of participants they did say that this sounds like it's happening. That's great. And we have a couple of 4s and 3s. So really very few people put 1 and 2 that this is not happening at their coalition. That's great news. And then for the second statement, we have also about 50% that said 5 and then have I would say combined about 75% of participants marked either 4 or 5, that there is a focus on priorities identified from the comp plan. That's really great. And then finally, with the last statement, it's a statement about members knowing about and are involved and being involved in the action plan. We have about, looks like 46% marked either 4 or 5. But everybody said everybody marked either 3, 4, and 5. So really every member, it looks like from the participants that are in the coalitions, are at some level involved in developing action plans, which is really wonderful. So moving to the next part, before we introduce our speaker, I wanted to tell you a little bit about the CompCancer 101 Wiki on the GW Cancer Center's TAP Technical Assistance Portal. And I'm going to share my screen with you so I could show you how to get to it and do a quick introduction. We won't take long doing this. So if you go to the GW Cancer Center website, it's smhs.gwu.edu/cancer control TAP. You could always just Google GW Cancer Control TAP, T-A-P, and that should show up right away. This stands for the School of Medicine and Health Sciences. And then you see here that we have our wiki, our regular page, and then the first thing under home is the CompCancer 101 Wiki. When you click on that, this gives you a sense of, it's a live portal designed to help you with the nuts and bolts of various CompCancer Coalition tasks. and then you can scroll down and see the content pages, but really on the left here is where we have the different sections that we've been populating over the last 5 years. And so you'll see information, and many of you might be familiar with this already, on the CompCancer Coalition organization leadership structure, and then information and a lot of examples on CompCancer plan development, and then membership communication and engagement examples and content as well. And so the most recent section that we just developed is the implementation of state CompCancer control plan goals. And this is when we had we just received the content from 6 coalitions that we featured on the content, and basically we didn't put anything in this outside of those examples, and we'd like to continue building this content by getting your examples so more coalitions can look to others that might be similar to them or have similar settings, and they might be interested in exploring. For example, Montana, we have 2 submitted from Montana from the 2 different coalitions. You can see here Kentucky also submitted 1, and they could be a little bit elaborate, they could be a little bit shorter and just gonna give you a very good but general idea of what's happening. And you can also, we provided links to different things that are relevant, and also included snapshots to give a quick summary of what's happening there if you don't want to read the full content to find out if this is going to be useful to you. So we definitely encourage you to submit your stories and your examples around how you prioritize work plans and how you implement and track progress of implementation of CompCancer control plan goals. And so you can submit by emailing us and sending us an attachment, and I'll provide you with the guidance and a little bit of what to include in your write-up. You could also use a CompCancer 101 wiki submission form, which we just recently updated, so we should be able to reliably receive your submissions on here if you do not email us. So you can also choose a file and attach your submission here. We encourage you to do that rather than just submit your responses just to be on the safe side, but this has been tested, and we encourage you to use it as well. So I'm going to stop sharing my screen now. And here's a little bit about the guidance for what we'd like you to include in your submission. And so basically we want you to tell us how you prioritize your work, and what partnerships are most influential to you, describe how you track progress, and tell us a little bit about your successes and barriers to implementation, and that should help others to be able to think about if they have similar barriers or successes and how they might want to encourage communication and collaboration between different coalitions. So now we want to hear from our speaker. After the presentation, we're going to have a Q&A with Nikki, who I'll introduce in a moment, and then open the session for the audience. So it's my pleasure to welcome today's speaker, Nikki Campbell, who holds a master's degree in exercise science and health promotion with an emphasis on sports performance and injury prevention, as well as fitness and wellness. She's a certified recreation therapist, personal trainer, and certified inclusive fitness trainer. Nikki serves as a health education specialist for the State of Montana CompCancer Control Program. Her main work is as manager for the Montana Cancer Coalition, as well as the state liaison for the Montana American Indian Women's Health Coalition, which focuses on cancer care initiatives in Montana's Indian country. In addition, Nikki serves as the Cancer Control Program representative on the state HPV working group, and she enjoys anything that involves fitness and the outdoors, and is currently training to summit the Grand Peak at the Teton Mountains in July. So, Nikki, welcome. And I'll go ahead and switch. The floor is yours.
Thank you so much, Mohammed, and good afternoon, everybody. As Mohammed said, my name is Nikki Campbell, and I am absolutely honored and excited to talk to you all today about the work of the Montana Cancer Coalition, as well as the Montana American Indian Women's Health Coalition. Throughout the presentation, I will be referring to the Montana Cancer Coalition as the MTCC, and we'll be referring to the Montana American Indian Women's Health Coalition as MAWAC. So to start off, the Montana Cancer Coalition, or MTCC, our mission is that we strive to ensure better quality of life and enhance the odds of survivorship through prevention, early detection, and state-of-the-art cancer care. A little background, a little history on the MTCC. In October of 2003, we officially held our first statewide stakeholder meeting. In July 2004, the Montana Comprehensive Cancer Control Program, or the MCCCP, received planning funding. And in April 2006, our first CCC 5-year strategic plan was released. And since then, we have had a second plan that ran from 2011 to 2016, and our most current plan from 2016 to 2021. Today, our membership is 235 individuals with an average of 80 people attending our statewide meetings every year. Our steering committee holds 28 representatives in various positions, which I'll be going through in just a little bit. And we have 7 implementation teams that focus on the different facets of our 5-year plan. So to give you a visual, I know myself, I'm a very visual person. This is our MTCC organizational chart. Our implementation teams is something that I do want to reflect on a little bit more, but I'll take you through the generalities of the other areas. The MTCC members are volunteers. We are a federally funded coalition, and we serve on an administrative board. So the administrative board is made up of 2 co-chairs, a vice chair, an immediate past co-chair, a DPHHS representative, which is myself for the Department of Public Health, as well as a provider advisory group liaison. Our steering committee, again, is made up of 28 individuals. We have 7 implementation teams. Each team has two co-chairs that lead in tandem. So we have the Prevention Sun Safety team, the Prevention Nutrition and Physical Activity team, the Screening and Early Detection team, an early detection team that focuses specifically on lung cancer screening, our Treatment and Research team, Quality of Life and Survivorship, and finally our Pediatric Cancer team. We also have 8 representatives that provide insight on behalf of various member groups of our coalition, such as our Montana American Indian Women's Health Coalition representative, Indian Health Service, American Cancer Society, Policy and Advocacy, and Disability Consumer, as well as our general membership representative. So to get into the choosing and updating of work priorities, the priority selection in Montana is very much a team-driven activity. The one thing I do want to emphasize strongly is that this is not just the plan of the Montana Cancer Coalition, this is the state's plan. The original selection and review of work priorities spanned across multi-level statewide partners to ensure consistency and inclusion. And just a few of the examples of individuals and partnerships that we included in the development of this plan are listed. So everyone from the state medical director to the Department of Public Health, the Chronic Disease Bureau, the Cancer Control Programs, the coalition itself, the U of M, the University of Montana Rural Health Institute that focuses on working with those with disabilities, as well as MAWAC, were included very heavily in the development of our plan. Another area that I do want to specify is that originally we developed and distributed a feedback survey to various cancer care professionals inquiring about what they would like to see most in the plan. At the Big Sky Oncology Conference in 2015, we had 75 medical professionals complete a survey that asked about what they would like to see in the development of goals, objectives, and strategies. Pediatric cancer initiatives were most wanted. And as of 2016, Montana is one of only 2 states that have a section in their 5-year plan dedicated to pediatric cancer care initiatives, as well as the inclusion of focus on people with disabilities and disparate populations. These both emanate all throughout the plan. Specific work plan components that we feel in Montana are absolutely essential is that this plan is comprehensive, of course. It's cost sensitive, it's culturally sensitive to apply to our disparate population demographic, as well as evidence-based and data-driven. We want to ensure best practices at all times. The needs of the state of Montana need to be outcome-oriented, And above all, we need to be respectful of the individuals and organizations' rights, dignity, privacy, and safety. So continuing on with choosing and updating work priorities, just to give you a short little synopsis, annually, the MTCC Steering Committee, which really drives the work of the plan, they meet to review the strategic plan at their leadership retreat every spring. They discuss the priorities that have been chosen for each implementation team objective, and they assess whether to continue or modify the approach to the current priority or select a new one. We do have quite a few objectives in our plan that are accomplished in 1 year, and a few in our plan that take more than 1 year. So we have no problem carrying over work. It's essential to get this work done, and we really try hard not to put a hard timeline on when we need to get these initiatives completed. If the teams and the organizations involved need more time, then we give them more time, because we feel it's extremely important to maintain the value, maintain the integrity of the identified objectives. So the step-by-step process, so getting a little bit more into the nitty-gritty of exactly how we do the choosing and updating of our work priorities. So step one, as I said, we review the priority objectives and strategies from the cancer plan. Step two, the prioritization of 1 to 2 strategies to focus on over the next 12 to 18 months is done. In addition, there's the developing of team projects within our implementation teams on the coalition to progress the work, and then the identifying and assigning roles to team members. So various team projects, I will be getting into more specifics in a moment. Step three, the identification of additional partners to involve, identifying current efforts that are underway, either internally among partners or externally in a particular area or objective. Step four, and this is extremely crucial, is answering of questions about the strategies chosen. Basically figuring out what's the why behind these strategies. Why are these strategies so important? And then based off of those answers, identifying and addressing current and or potential challenges. We discussed that very much in depth about the challenges that we are currently facing or may face, and we really work hard to strategize outcomes or ways that we can attack these challenges and barriers so that we can get this work done. Step five is the completion of a priority action plan and resource matrix. So the completion of a timeline that includes process metrics, as well as additional resources needed, such as materials, funds, skills, etc. So this is just looking at what our team priority action plan consists of. And so the priority strategy, the expected outcome, how progress will be measured, etc. And then the resource matrix, this is what ours looks like in regards to the types of resources that are needed, the estimated amount and cost, and so on and so forth. So in connecting the pieces, using the work plans to track progress. So number one is the MTCC implementation teams identify and evaluate priority objective progress annually and develop their work plan, as I stated earlier. Within the work plan, the team projects are developed, recorded, and project tasks are distributed among the group. Number three, team calls take place monthly among the implementation teams to discuss work plan progress. Number four is teamwork plan progress. Reporting is submitted monthly. It used to be quarterly, but we found that it's a lot more beneficial to see it on a monthly basis. It is submitted to myself through our leadership portal on the MTCC website. So the uploading of agenda notes and the attendance sheet, noting in-kind hours of team participants, different questions that are answered by the implementation teams within this report include the summary of identified priority objective progress, challenges and barriers being experienced, if any, and strategies to overcome these barriers. These questions directly correlate with questions asked in progress reports submitted to the CDC and help to provide accurate information. Also, things that are asked are if the team is in need of assistance from the administrative team of the steering committee. If that box is checked yes, the admin team member contacts the co-chairs. And once they are done with this, they simply submit. And the work plans can be used to inform and or support partner activities. Number 5 is work plan progress is compiled into an MTCC annual report and communicated to the MTCC and chronic disease partners. Number 6, the statewide plan progress translates into areas of the Montana Cancer Control Program work plan progress itself. And number 7, finally, we report the MCCP work plan progress. We enter it into the Chronic Disease Management Information System and submit to the CDC, and this directly contributes to the satisfaction of MCCP grant-required work. So you can see just by these steps alone how everything ties together in order to ensure progress on our work. And so now I've concluded talking about how specifically the MTCC does their work, and now I'm going to talk about the Montana American Indian Women's Health Coalition, or MAWAC. MAWAC does do their work differently, and you can see this in the slides that I'm about to show you. So MAWAC is a unique group of women that work to educate their communities about cancer and its prevention, early detection, treatment and research, and survivorship to reduce cancer disparities in Montana. So a little bit of background about the American Indian tribes in Montana. Montana is a very unique state, especially in its geography. We have just over 1 million residents. We are the third most frontier state in the nation out of 6 states. And just to clarify what a frontier state means, it's a state in which at least 50% of the counties in the state are frontier counties. And this means that counties in which the population per square mile is less than 6. Within Montana, we have 65,000 American Indians that reside, and American Indians carry the largest burden of health disparities. As you can see within the seals on the slide that you are looking at right now, we have 7 federally recognized tribal reservations, but within those reservations, we actually have 11 tribes. They are sovereign nations, meaning they govern themselves. The biggest challenges with these populations is limited access to health care, cultural barriers, and travel distance. So some MAWAC history. In 2000, as part of the American Indian Screening Initiative, or AISI, the leadership of the MCCP, Montana Cancer Control Program, formed MAWAC. The American Indian women representing MAWAC include those from tribal communities and tribal health systems, urban health programs, and urban communities. Originally, MAWAC was formed to assist the MCCP in recruitment and screening of American Indian women for breast and cervical cancer, and over time it evolved into a coalition that addresses issues along the entire cancer continuum. The MAWAC structure, general membership, includes 64 members. These members are American Indian women dedicated to reducing cancer disparities in Montana's Indian country. They operate as one unit versus breaking up into various implementation teams, and their leadership consists of a president, vice president, and secretary. So very quickly, I promise not to read from the slide. I know this is a lot of information, but I feel it's extremely important. So in regards to MAWAC's coalition plan from 2016 to 2021, it's a complementary companion document to the statewide CCC plan that specifically addresses American Indian needs. They have the same overarching goals, and objectives are utilized in the MAWAC plan as in the CCC plan. The strategies are developed to address these overarching objectives geared towards the American Indian population, to address cancer health disparities within Montana's American Indian country. The cool thing I want to highlight about the MAWAC plan is it's the only one of its kind in the nation. Both the MAWAC coalition model and the MAWAC plan have been used as an example to other tribal and public health organizations in various states that look to achieve data-driven progress in their local, regional, and statewide American Indian health initiatives. So in regards to how MAWAC tracks through their outreach, actually, annually, MAWAC identifies their priority objectives to work on, again, as one unit, and develops projects that serve to progress the work of their strategic plan. So some of these projects include a mammography bus and screening education during pink ribbon bingos that are held throughout the state, partnering with the American Cancer Society to offer the Circle of Life cancer education training, as well as performing outreach and education on MAWAC as well as cancer care initiatives at powwows and other events throughout the state. So the MAWAC State Liaison, i.e. me, I am present on all MAWAC calls with leadership and planning groups that decide to do different events throughout the state. And then I report progress to the MTCC Steering Committee, the Montana Cancer Control Program staff, and the CDC through our reporting when appropriate, as well as the reporting of plan progress that's performed by MAWAC leadership annually during their statewide meeting every spring. So one thing that we in Montana are extremely excited about is in regards to a little bit more about MAWAC tracking and outreach. You see this big arrow pointing down and 3.3%. This is a huge number to us here in Montana with regards to the health disparity initiatives and our work towards health equity here in Montana. Due to the data tracking and dissemination of the information that I just discussed and the consistent reporting of outcomes from screening and outreach events, MAWAC has become a valuable partner, extremely valuable partner in the work to reduce cancer burden in Indian country. This year it was reported by the Montana Central Tumor Registry that cancer incidence has decreased significantly, and that's decreased significantly among Montana American Indians since 2006, with an average annual percent change of 3.3%. And that is a huge number when it comes to working with the American Indian populations within our frontier state here in Montana. There's still a lot of work to be done, but this is a big step towards reducing cancer burden in these populations. So just a few fun pictures to give you a little bit of perspective as to the type of outreach MAWAC does. So the big picture on your left is actually a pink ribbon bingo. And so these women come from areas all throughout Montana to attend these pink bingos. And there is a lot of cancer education screening and screening that happens. A mammography bus is provided for these women to get their screenings done on site. And the way that they get into these pink ribbon bingos is filling out a form that is then submitted to one of our local contractors, and they are then they are contacted later on to get their screenings scheduled. So they are not able to get in and take part into this pink bingo unless they fill out a form. And this has been a very beneficial, a very efficient way of reaching these women in order to get the screening numbers to increase here in Montana. There are also a lot of fun things like raffles, of course, bingo, and I had the honor of attending one of these and seeing firsthand how they're done. And they had over 300 American Indian women come, and boy, what a fun time. Just a lot of laughing, a lot of joking, but a lot of talking about screening and why it's so important. Up at the top right, we have two of our members from MAWAC manning a table, talking about the importance of the plan and why MAWAC is such a great organization to join. The one thing I do want to say about MAWAC and MTCC is these are volunteer. There is no cost to join. And so really communicating the value of why you should be in these coalitions is that much more important. And the bottom is one of our members manning the MAWAC table at a powwow event. And so thank you so much for listening to my presentation today. I'm very honored and very excited to have been asked to do this presentation. Thank you so much, Mohammed and the GW Cancer Center for having me. If you are interested in contacting me, I love sharing information. I love talking to coalitions that really want to work to increase membership and the efficiency of their priority work plans. I am an open book. I have no secrets when it comes to, keeping things about, what we do as a coalition. We're so open to sharing the things that we do, and I would love to be able to help anyone that would care to reach out and talk a little bit more. So here is my information. Feel free to call or email me. And our website is open to viewing. You can find out more about the MTCC as well as MAWAC, various resources, and get a little bit of insight to what our members are all about at mtcancercoalition.org. And I look forward to speaking with you if you choose to reach out. So thank you so much, Mohammed, and back to you.
Thank you so much, Nikki. All right, so I have a lot of questions for you, but I don't think I'll have time for all of them before we open it up to the group. So first I want to say that Nikki also submitted the 2 wiki entries that I told you about, so you could already get some of those questions that I have in my mind answered there, and there are links as well, so you can always link to the different plans and the 2 different websites for the coalitions. I think maybe I'll just ask you the one question that maybe others are wondering about. It would be wonderful to just tell us a little bit about some of the challenges working in a frontier state, and I think in not a lot of states here are frontier states necessarily, but anything that would help folks who are in very large rural populations. So any challenges as well as recommendations on how to kind of address those challenges and work with either tribal or other communities to really try to achieve health equity in the cancer space.
Certainly, those are great questions, Mohammed. I'd be happy to answer those. For Montana, the challenges and successes of working here in a frontier state, I have 3 that come to mind immediately. And one of the things that we struggle with here in Montana is the distance to travel, the distance that people have to travel to even access care. In some areas, the distance to a medical facility is hundreds of miles away. And so you can imagine for a lot of people that may not even have the ability to get transportation, the frustration that can bring on someone who needs to get their screenings done and needs to get treatment. That is something that our implementation teams are working really, really hard on in regards to helping to diminish that barrier. The second thing is the lack of resources in our smaller areas, and really lack of resources can carry over into whether you're a frontier state or not. The lack of resources in smaller areas, again, for some transportation, things like transportation is limited or non-existent. Lack of funds, inadequate facilities or tools to support proper care of patients. Provider turnover, those are some other things that we really struggle with. And are constantly working on to really figure out, really problem solve and attack those issues that we are having here in Montana, and who do we bring to the table to be able to discuss those more thoroughly. Our climate in our medical, our medical arena is changing every day. And so we're constantly getting in new ideas, new partners, but we have to do the work as a coalition too. Not everyone, the one thing here is, especially when we were working on rebranding the coalition with a new logo and, new face basically, the number one thing we got is we didn't even know the MTCC existed. And so really working on outreach is huge, and getting out into the community and no stone left unturned, basically. Go into those clinics, go into those hospitals, reach out to people that you think might be valuable assets to your organization, and talk about those hard things, because they may not even realize that you can help. And so those are the challenges that we deal with. One big success is, in those challenges, there is a silver lining. And we find the silver lining to be the ability to adequately communicate the value of the coalitions, as well as the programs we provide, the initiatives that we're working on, and why coming to the table is so important. Communicating those ideals on a more constant basis due to our unique setting, and being a frontier state, but also being an organization that, we're working every day to get out there and get noticed. And help people realize that we can offer the help that they need, and if we can't, we sure as heck will find someone or some organization who can. So it's really about being diligent, being motivated, and being passionate about your cause. Some recommendations to other coalitions, and pardon me for being a little long-winded about this one. There are a lot of recommendations that I have, and I'll be as brief as I can. The first and foremost to recommendations for coalitions is to educate yourself on how to work appropriately with said populations. Every population is going to be different, knowing your why. I go back to knowing your why. Putting a personal reason why you want to help this demographic is so important. Once you put a personal reason to the task at hand, it makes the work that much more meaningful for you and for the organization, for the individuals that you are helping. Remember, it's coming down to the individual. You are helping people. And so just when you break it down like that, it makes it much more meaningful. Taking classes, I know that sounds kind of broad, but taking classes and educating yourself on the cultural background of the population you're looking to work with, and know specifically what you're looking to achieve in your work with them. You will get asked about your intentions. So it's important to be sure you're educated on the point of why you're working with those individuals and have a clear end goal. Always ask questions. Do not be afraid to ask questions. In my work with people with disabilities as well as the American Indian population, I'm a small town Midwest girl, and so this has all been an adventure for me, a journey for me in getting to know these populations and really understanding what they need. Asking questions is so important. Do not pretend to know everything. There's more respect between parties when you show that you have good intentions to learn from who you are assisting. Leave the name tags at home. This is something that I learned early on in my work. Be genuine, personable, and sincere. Leaving the name tags at home meaning some people find it very intimidating to talk to someone when they are from a state agency or from an organization that's coming to help them. So leaving your name tag at home allows you to be on the same level with someone and to really help them to understand that you are hearing them and you are with them, you are in their corner, and you're on again the same level to be able to help them as best as you can. Do not take anything personally. For a lot of these populations, there's a deep-seated history of historical and generational trauma that has nothing to do with you. Know what historical and generational trauma is and respect it. It's okay to think unconventionally in order to accomplish success as long as it's ethical, respectful, and for the benefit of the population you're serving. And finally, be yourself. There's a lot of strength in authenticity, and this makes for more meaningful connections. So that's all I have, long story long. So,
this is amazing. Thank you so much.
You're very welcome.
This is really helpful for everyone. I think there's going to be a lot of similarities between many coalitions, and we definitely encourage communication between them and you and between each other. So I want to open it up for a Q&A from our audience. But before I do that, I actually wanted to hear from folks as well about what their process is, just to quickly give you some logistics. So WebEx has changed their platform a little bit. Look to the bottom center of your screen to find the chat icon. You can also raise your hand next to, that should appear a little hand symbol next to your name, but we prefer that you send us chat. This way we can retain that you're interested or that you asked a question and maybe get back to you afterwards as needed if it's something that we can follow up with you on. So we prefer that you click on the chat icon, and then the chat panel will appear on the right side of your screen once you do that. So it should appear, the icon should appear as blue, and then you look on your right, and then you should see the chat function. So please feel free to start sending questions for Nikki or me or anyone from the National Partnership as well. And then I wanted to ask you also, and this is how we would like you to participate, we are getting close to the end of the webinar, so I want to give you a quick moment to tell us a little bit about what the priority work planning process is for your coalition. So you can chat us to tell us that you're interested in speaking, and we'll unmute you, or you can actually let us know what the process is, and of course you can do that through a submission from our wiki, or just kind of sending us an email. And I'm going to ask Lauren from West Virginia, from the Mountains of Hope, to tell us a little bit about her process. Lauren, you should be unmuted.
I am. Thank you so much for having me today.
Absolutely.
Our main process is that we get our whole coalition together and we kind of take our priorities from our cancer plan, of course. There's 25 in there, and we try to get it down to approximately 5. And it's really just a process of elimination, and we get the whole group and everybody votes. And then we take those top 5 and everybody chooses which one's most important to them, and that becomes their work group for the next 2 years.
Great, thank you. And I also would like to ask Mac from Louisiana to tell us a little about his coalition.
Good afternoon. Can you hear me?
Yes, absolutely.
Great. Sure. In Louisiana, we're structured a little different, where we have, although we have a state cancer coalition, we've separated tobacco and obesity-related issues into the Louisiana Healthy Communities Coalitions, and they work primarily on policy systems and environmental changes. In other areas, we have the colorectal cancer roundtable and an HPV immunization work group, and we use those separate groups to really focus on specific efforts and opportunities to make an impact in those areas. The state leadership team, which was a new requirement of the 1701 grant that Comprehensive Cancer Control is a part of, is where all of the leads of those separate coalitions really get together and talk on a quarterly basis. Thank you.
Great, thanks, Mac. And I think we have a question from Shannon. What process, I believe this is for Nikki, what process did your steering committee initially use to narrow down a few priorities out of your cancer plan the first time you did that?
Sure. Thank you so much, Shannon, for that question. So the big thing that we looked at is, I believe it was the second slide that I showed, is we just wanted to make sure that our work aligns and is consistent with our state health improvement plan, as well as our chronic disease plan. Just making sure that there is consistencies among the objectives that we are identifying as priorities for the year. But the other thing that we do is we look at what's happening in the state, what's happening across, the state that we live in, as well as among organizations. What's happening that we can apply these objectives to within our organization. So, such as the Montana chapters of the American Cancer Society, our partners with the cancer support community, as well as our tribal health organizations. So just looking at what objectives apply to what's happening in our current climate. And then we take the strategies that apply to these objectives and we take it down to the number one strategy that we can apply to the objective we want to work on for the year. And then we, again, form projects to help drive those strategies and move the work forward. So I hope that that's helpful. We actually did that the first year, and then we come back around for year 2 and so on and so forth, and we revisit what we've chosen, what has been working well, what's not working well, and what we can modify. And the plan is actually really it's a living, breathing document. So it is up to be modified. We're changing strategies and rewording things all the time because, again, the climate is changing, and so we need to be fluid with that. So I hope that helps.
Great, thanks, Nikki. And I think I have a question from Lauren from West Virginia, asking, how do you share your progress with your coalition members?
That's a great question, Lauren. Happy to answer that. So once we have our information together from the work that the implementation teams that have done, I compile all of the work from the monthly reports that are submitted by the implementation teams from their calls, and we compile it into an annual report every year that is communicated to the MTCC at their annual statewide meeting. This is also a publication that is virtually communicated on the MTCC website, and it's actually open to anyone to be able to view. And so that actually also helps in our recruitment so that people can see what is actually being done. People want something tangible, and so we make sure to have it as a visually enticing, I guess you could say, type of communication. So that in turn then is communicated also to our chronic disease partners and then all the way up to our reporting that we submit to CDC.
Great, thanks so much. I think that is all the questions I have. If anybody, Leslie from the National Partnership, if you have any comments you'd like to comment on before I move on to the next couple of slides to end, feel free to do so, or Margaret.
Hi, Mohammed, it's Leslie. I just wanted to add to what Nikki said about choosing priorities. In some cases, a lot of coalition steering committees, they might, especially the first time you're prioritizing, or if you haven't done it for a while, the steering committee might take a first cut at looking at across the whole cancer plan and using some common criteria to decide, you know, this seems to be a priority for us, and then take those as a suggestion to the full coalition to ask for input. So we've seen it go both ways, where the steering committee might take a first cut. Sometimes they decide to take it first to the whole coalition and then get input and make a decision from there. So it varies. There are lots of different ways to set priorities, but it's a great question, because setting priorities is actually the first thing you need to do with this priority work plan.
Great. Thank you so much, Leslie. And I think taking us on, because I do want to give a little bit of time to take the evaluation, we wanted to tell you about our next webinar, which I mentioned in the beginning. So we want you to continue your exploration of the 9 habits with this third webinar on diversified resources. We'll take a closer look at Habit 5, which emphasizes the importance of diversified funding and resources for implementing your coalition priorities. So be sure to sign up, and here's a bit.ly. Feel free to take a moment now to copy that into your browser and register for that webinar. And as I mentioned before, we are looking for new CompCancer Coalition examples to include in both the wiki that I talked about for GW's TAP website, but also for the guide. We are looking to update it. Montana actually had a spotlight in that original one, which is why we reached out to them to ask them to talk about their experience, and they've updated a lot of their processes since then, so this was really timely. So if you do have a success story to share and tell us about your coalition and how you've used the habits, please contact Karen or Leslie from the Strategic Health Concepts, or anyone really from the National Partnership. We are happy to communicate that information and get it in the updated document. And so finally, I'd like you to take a couple of minutes that we have left to definitely send us any other lingering questions and take some time to answer our polls so that we can continue to improve our webinars and think of new ideas for our next iteration. Thank you very much. So we'll take another minute. I wanted to use the time in the webinar to do this. I don't see any other questions, but feel free to send them in the chat. And I want to thank everybody from the speakers, Margaret and Nikki especially, for taking the time to speak to everyone and also submit the wiki and having the spotlight before. We certainly learned a lot from Montana, both coalitions, and what you're doing. So we really appreciate that time. And we also appreciate the volunteers who told us a little bit about their processes, Lauren and Mac from West Virginia and Louisiana. and all your other questions as well. So feel free to get in touch with us, and we'll see you in next month for the third webinar. Thank you very much.